good morning to one and all present here. Have a gorgeous day. On behalf of IHML Kancheepuram chapter, I invite you all for the webinar on this glorious day, the arrival of gracious Tamil New Year, stating the quote of a great poet Mahakavi Bharatiyar, யாமறிந்த மொழிகளிலே தமிழ் மொழி போல் இனிதாவது எங்கும் காணோம். And I am wishing you all a very prosperous Tamil New Year and happy Vishu. The session is specially arranged for dedicated doctors and students who have spared their time in this special New Year. Now, it's important to know about the background of our IHML. IHML is the foremost homeopathic organization in Tamil Nadu, having its wing all over the state. First accredited Homeopathic Association of Tamil Nadu, Qualified Homeopathic Doctors Association, was established in 1988. Seats for the association were started by the Dr.G.Srinivasan from Madurai. Dr.S.P.Koppikar served as a president in this association. This organization later transformed as Tamil Nadu Homoeopathic Doctors Association in 1996, and Dr.N.Subramanian, Dr.R.Gnanasambandam, and other senior doctors later established the Indian Homoeopathic Medical League. The special thanks to our chief guest of the day, Dr.H.L.Swamy, sir. It's our honor to be graced by your presence of such an intellectual person and a staunch homeopath, sir. A very warm welcome to Dr. P.V.Venkatraman, sir. The seminar has been arranged on the account of celebrating the World Homeopathy Day, which is celebrated on April 10th, to commemorate the birth anniversary of our founder of homeopathy, the great Dr. Samuel Hahnemann. Let's start with a beautiful quote, hold fast the things which is true. I now call upon Ms. J. Mokita to deliver the speech about our chief guest.
It's a cheerful morning to all the doctors gathered here. It's my privilege to introduce our esteemed chief guest for this New Year morning, Professor Dr. H.L.Swamy, sir, a staunch homeopath practicing and preaching homeopathy since last 3 decades. He is the chairman of Karnataka Qualified Homeopathic Doctors Association, Bengaluru, whose unwavering dedication has inspired countless individuals around the globe. Dr. H.L.Swamy, sir, is the president of National Institute of Clinical Excellence, Homeopathy, where his contributions has touched the lives of many. Dr. H.L.Swamy, sir, is the professor in Department of Pharmacy, Bhagwan Buddha Homeopathic Medical College, ex-principal in Anuradha Homeopathic Medical College and Hospital, Bengaluru. Sir is the former faculty, Department of Homeopathic Materia Medica at Government Homeopathic Medical College and Hospital, Bengaluru. Dr. H.L.Swamy, sir, is the renowned former member of the advisory committee in the Department of Ayush, Government of Karnataka. Sir is the resource person in National Health Commission for Government of Karnataka and Puducherry. Sir has credit of publishing numerous scientific articles for peer-reviewed journals. Dr. H.L.Swamy, sir, is the distinguished resource person for several CMEs, national and international conferences, and recipient of many prestigious awards. We are very privileged to have you here, sir. Welcome, sir.
Thank you, Mokita. It's well known that it's complicated to handle the acute cases, and we are awaiting to gather your precious reasoning, sir. To all the dedicated doctors and students, we have question and answer session in the end. So shoot your queries there. Make use of this webinar. Now the session is yours, sir.
Thank you, Nitya ji. Thank you, Mokita ji.
Thank you, sir.
For the wonderful, beautiful words about me. I don't know I deserve those words or not, but at least I am very pleasant to see even the video what you given. I was surprised to see that video where you made that one. Good. So before I start my actual session, so I want to wish all of you happy Sauramana Yugadi, happy new Tamil New Year, happy Vishu. And there are several parts of the country they are celebrating this New Year celebration a different name, but say Happy New Year. Okay, and I extend my warm wishes for all of you on the occasion of the World Homeopathic Day, our master's birthday celebration, for which we are all assembled here. So before I start, I wanted to tell you one more. We are like a brothers. Okay. Your association is started as a Tamil Nadu Qualified Homeopathic Doctors Association, and almost in the same time, in 1992, we also in Karnataka, we started Karnataka Qualified Homeopathic Doctors Association with the guidance under the guidance of Dr. B.D. Patel sir. How the Koppikar sir is for Tamil Nadu, Patel sir is for us. And both of them are very good friends. Koppikar sir, we have the blessings of him. First time Koppikar sir got a Lifetime Achievement Award from KQHDA. This is our relationship. Sir, am I right, sir? Venkatraman sir. And our
relationship. Sir, you are right, sir. You are right.
Our relationship with you is also more than 3 decades, sir.
Yes, sir.
Yes, sir. Also.
Yes.
So we are all blessed to see him, talk to him. We worked under this guidance. So even today, I tell one of the best book for all the homeopaths to read is 70 years of my experience with homeopathy by Dr. Koppikar sir. Please go through for youngsters. I don't know how many of you are aware or not. So one of the wonderful book. Okay. So with that, I will come to the today's topic. See, it is a misnomer in homeopathy that homeopathy is good for chronic diseases. Ayurveda and homeopathy is all for chronic diseases. For acute diseases, only allopathy. It's a very wrong notion, at least in the public they got. Usually they tell that homeopathy is slow. If you start today medicine, it will start acting after 5 years. But I know all of you who are practicing homeopathy, studied homeopathy, you know that is not true. But in public image it is there. But at least not with my patient. My patient knows that the homeopathic medicines work as faster as allopathy or sometimes much faster than allopathy also. But I will tell you, you will click in the practice if you are good in treating acute disease. You get name, fame, money, all that will come more with the acute practice. How you successful in acute cases, that will bring you name, that will bring you the money, than chronic diseases. Chronic diseases is for our satisfaction. It is for long term. It is equally important. We have a mainstay on the chronic diseases, but equally we can treat the acute diseases. Today, with this small presentation of 1 hour, I try to show few cases. Through cases, I'll try to show that how good we are in acute prescription, how to do the acute prescription, what are the guidelines to be followed. Okay, those things with the cases, I try to elaborate, I try to explain. Okay, Dr. Trupti, can you slides? Okay, good. Full screen? Yes. So management of acute diseases. Acute diseases can be divided. How many types of acute diseases are there? See, in my session, usually I'll feel comfortable with talking, interactive, than just reading. Either right or wrong, you keep telling, you keep answering. Otherwise, see, whenever, especially webinars, it is like talking to the wall. We cannot see you. Only at least if you can talk, at least we can hear you. You can unmute and talk, again, mute it. Okay? Or you can chart also. On the chart box, you can chart. Okay, next slide. Acute disease per se means any disease which comes suddenly, symptoms, it comes suddenly, stay for a small time, and disappear with or without treatment, or it ends with the fatal. This is the definition of acute disease, you all know. Sudden in onset, short period of time, and sudden decline or gradual decline with or without treatment, or it may end in the fatal. That is acute disease per se. Acute exacerbation of the chronic diseases. There are some diseases where it is already there, sudden increase of the acute condition. That is called as acute exacerbation of chronic disease, like sudden wheezing attack in asthma patient, known allergic bronchitis or known bronchitis case, known bronchial asthma or arthritis, so rheumatic arthritis. So these are the cases where already they will be suffering for months and years, but sudden attack comes, sudden pain comes, sudden swelling of the joint, sudden pain, or sudden breathlessness. These are called as acute exacerbation of the chronic disease. Third one is acute presentation of the chronic disease. Disease is chronic. For example, IBS, irritable bowel syndrome, Crohn's disease. But when they come as a loose motions. So since morning, 7 to 8 times motion, continuous, watery, bloody, all that, dysentery. Okay. But that dysentery is a presentation, acute presentation of the, if you go back and see this thing, then it may be a chronic disease, but presentation will be acute. Whenever we are handling this type of cases, you all in acute cases, you should know, is it this condition is acute disease per se, or acute exacerbation of the chronic disease, or acute presentation of the chronic disease. This will give you clarity so that the way you handle the case, okay, or what to be followed up, what to see in our follow-up, okay, that all determines on the what type of acute disease we are handling. Any doubt until this? Any doubt? Is it clear? Am I clear?
Clear, doctor.
Okay.
Yes, sir.
Very good, very good, very good. We will go to the next case itself. Okay, case number 1. This baby of 6 months, female baby called Anya said, she was brought to my clinic, baby with the symptoms of, she used to cry 3+, continuous crying, especially more crying before stools. Just before stools, she used to cry a lot. Otherwise, continuous crying, especially at night. From 7 p.m. to 2 a.m., non-stop crying. Non-stop crying. Neighbors, their other people who are staying along in the same building, everybody is coming and asking their parents what happened, why is this baby is crying, why it's not. Non-stop crying was there. Okay, it is for last few days. And they tried some different things. It was not stopped. Then they came to me. Okay, when I took the other this thing, they are telling her appetite is increased. She can eat every half an hour once. She wants some food. Keep on eating. But motion is not that one, only once a day. There is no loose motion, but she is eating. Either crying or eating, even at night also, in night also. Okay, next. When I observed, there was a big swelling on the left wrist. Left hand was swollen around the wrist and the little above the wrist on the upper arm. Right hand, left wrist, left hand and right foot. Left hand and right foot was swollen, but more swelling was in the left hand. Left hand and around the wrist. This was the presenting one, but that swelling was not so painful. If you touch that one, it was paining, but not so much paining was there, but it was paining. Okay, next.
So first case done, sir.
Okay. Now tell me. So these are the information we could collect. There are so many things this time, but it is relevant things I told. Now you tell me what you think. What do you think about this case? What is the remedy? What you should give? Can we take this case? How to proceed? Something you type here, something you type, something you talk. Tell me.
Yes, sir.
Fast,
We can
fast.
take the case.
Huh? Good, good. Somebody is talking, yes. Irritability, good. It shows the irritability of the child. Good. Minorana, belladonna, and agaricus. Very good. Why belladonna, madam? Yes, diagonally presenting symptom. Right upper, sorry, right lower, left upper. If you go to Boric, in Boric repertory, okay, you can see the diagonally appearing symptoms. Okay, good, good. Next observation. Or somebody put it is belly spell. Why belly spell? Have to tell me why. Why? Any other drug? Any other drug? This case, I was just opening the file. Chamomilla, very good Shilpi, Chamomilla. They came on March 17th. Okay? Came on March 17th. Ravenous hunger, cries before stool. Night aggravation, sulfur. Very good. Very good, Anushaji. Sulfur, because it is ravenous hunger, stool, night aggravation. That was chamomilla. Sanchita Roy, Jalapa. Good, very good, very good, very good. Good. Okay. Any other indications? Any other observation? And when they are passing this thing stool, passing lot of flutters, okay, it was, I told already, it was aggravation in 10 p.m. to 2 a.m. She had some bouts of motions also, okay, appetite is increased. So anybody have Boric Metromedica, Boric repertory, Metromedica repertory there? There are 3 remedies diagonally, upper, lower right, upper left. Anybody can tell which are the 3 remedies? Okay, fine. I will reveal the drug. The drug selected, as Dr. Sanchita Roy told, it is the Jalapa. Jalapa is the remedy. What is the indication? Sanchita ji, why Jalapa?
Sir, midnight aggravation and the child cries before stool.
Good. Especially crying, night crying non-stop crying at night is Jalapa. Highly irritable, weak, irritability, aggravation at night is Jalapa. If it is daytime, night it is quiet child. Whole day it cries. Which is the remedy? Lycopodium. Good. Lycopodium is the remedy. If the child cries whole day and sleeps nights, fantastic. That is Lycopodium. Child cries whole night, happy in the daytime, is Jalapa. Child cries day and night. Which is the remedy? Day and night crying. Chamomilla. See, in acute prescription, this type of tips you should have. Sudden, small differentiation that makes. Okay. I gave this remedy on 17th, and they came for the follow-up on this On 20th, this thing, first follow-up, 70% better swelling. Whereas irritability and crying is almost stopped. Swelling of the hand and legs also 70% reduced. Irritability at night was totally stopped. Child was sleeping and passed 3, 4, 5 loose stools. After that, she was better with lot of letters. Okay, child passed the, I told that what, follow-up one. She passed the lot of letters and passed 4, 5 stools and crying was reduced. She was sleeping very well. And again, we repeated the same medicine for again, she got irritability after 3, 4 months, one more time. Otherwise, child was fine. And even today, even after the 10, 12 years, those family comes to me, she is fine. Okay. Good. So we'll move to, see, in acute prescriptions, modalities makes a lot of difference. It is determined by the modality. What is mental symptom for chronic disease? For acute disease, modalities play the same role. Modalities will be the determining factor for the acute disease. Either it is a causative modality, or it is a aggravation, or it is a amelioration. Modalities plays a major role. Next case. This is, no. Please go back. Is a boy of 11 years. He came to me with the present, his mother brought to me for a fever for 1 week, several paroxysms per day, several times the chills, heat, sweat phases used to come, pain in the abdomen, and the abdominal pain used to better by rubbing, especially even in front of me when the boy was sitting, he was doing like this. I'm showing in the chest, but not in chest. He used to do it on the in the stomach area, abdominal area. Okay. So bowels was alternate days, but it was little loose. Patient was dull, drowsy, sleepiness during fever. Fever starts with headache. And this fever started because of his final exams. Patient was shown to pediatrician, taken treatment for a week without any benefit. With that, actually this patient's cousin sister was my student. It was referred through her. Okay. So when it was, they shown to pediatrician, but not better, fever was continuing for last 1 week. Then they brought to me. Any suggestion here? Gelsemium, good. Dull, drowsy, sleepy, headache, remedy for examination fund. Very beautiful. Good, good, beautiful. Aconite. Okay, aconite. Because of sudden onset. Okay. Gelsemium, Satya, gelsemium, very good. Good. Then plumbum, Nishi Patak. Nishiji, tell me the why plumbum? It's very beautiful, out of the box thinking. Good,
Sir,
good, good.
amelioration by rubbing.
Amelioration by rubbing.
Rubbing
good,
the abdomen. Yes.
Rubbing the abdomen. Very good, very good. Okay. Then Macarb. Okay, Macarb, better by rubbing. Very good. Very good. Balamar bench. Then even here, the case of the fever one, it used to give more and more indication towards gelsemium, but I took the better by rubbing as a peculiarity, PQRS, and I prescribed podophyllum. I prescribed podophyllum for this case. If you have boric, you just open and read it. In podophyllum, it is there, patient, especially in the liver area. Okay. So next slide. Lab report shows rise DSR, Vidal positive, abdomen pelvic USG. Next, hepatosplenomegaly. The hepatosplenomegaly, I think if I had showed this slide before, I think we would have been much more clear with this thing. So otherwise, generally we don't think no podophyllum for the typhoid fevers. We don't think no typhoid fever means we always think of which is the remedy?
Baptisia, sir.
Baptisia, yes. The moment patient comes with the report Vidal positive, we think of this thing. See, this is thinking out of the box. I gave podophyllum, I think 30 or 200, few doses, this thing, and patient was completely recovered. Okay. Next. See, I'm showing the different indications, the selection of medicine on different indications. Okay. How the acute prescriptions can happen. This baby Noir, aged about 18 months, baby was brought by her grandfather for continuous crying without any apparent reason. There is no reason. She used to cry. Continuously she used to cry. She had cold cough for last 2 days. Child did not allow her grandfather to enter my chamber. She started crying in high pitch. The moment his grandfather started coming inside, this thing, her high pitch. Her crying reduced only when she was carried on his shoulder. I could see her face, nose, mouth was red due to crying. Only her tongue was white coated, thick white coating. Any slide is there for this case, Trupti?
No,
Only
sir.
one slide?
Only one slide.
One slide. Okay. Yeah, now tell me, what is the indication and what should be the remedy?
Sir, chamomilla, antimcrude, like antimcrude as
Very good. Chamomilla, beautiful.
better
And
when
antimum
crying and antimcrude as thick, coated thick. Yeah.
crude. Okay, good. Ashita also told antimum crude. Good. Anything else? Any other remedy? I think these two plays a major role. I gave antimonium tart 200. If you have Metramedica, go and read. Antimonium tart is better by carrying on the shoulder. And thick white coating of the tongue is also there in the antimonium tart, not only in the antimonium crude, even in antimonium tart it is there. Okay, antimonium tart also it will have thick coating. Okay. Next. This is a college going student. He came with a pain in the left foot, especially on the left big toe. It will become like a wound type of thing with the swelling and pain of that big toe. And pain used to be very much when he is ascending, when he is going up. Okay. And his classes was there in the 3rd or 4th floor. And every time when he is climbing, he used to have a severe pain. It has a slight swelling, but no redness, only like a wound type of thing was there. Pain aggravated by pressure, wearing shoes, better by removing these shoes. On examination, I saw what is the problem. It was an ingrowing nail. You all know what is ingrowing nail? Ingrowing nail. In allopathy, for this, they do the surgery. They remove the nail, complete. The toe nail they remove. Only next new nail has to come. So many times it happens, even the new nail which comes also, it will start ingrowing. Which is the remedy? Already I told the diagnosis now. Very good. Magnetum polus astralis. Good. Any other remedy? What is the indication, sir? Silica. Good. Sir, silica. Good. Shilpi. Good. Silica. Any other remedies? This patient, nitric acid, beautiful. Nitric is also beautiful remedy. One more remedy is there. You are all missing for ingrowing nails. Nitric acid, good. Then Tucrium, Tucrium, one of the beautiful remedy for the ingrowing nails. Generally, Tucrium we all think only for the nasal polyp or worms, but also equally, even in Kent repertory, it is highest marks. Yes, Hepar sulf, also beautiful remedy. In Hepar sulf, even slightest touch will be very painful. Graphite is good. Graphite is also beautiful remedy. Allium cepa, okay. Allium cepa is there. Causticum, yes. Causticum is good. Causticum, beautiful medicine. Tuja also beautiful medicine for ingrowing nails. For this boy, I gave silica. I gave silica on the basis of it is that it caused a wound type. Wound, where the patient used to feel better when he in college it's compulsory to wear the shoes. Moment he come back home and he removes the shoes, he used to feel better. Okay, aggravation by pressure. Okay, next, it's a case of hematuria. Okay, with the pain in abdomen, right side of the abdomen. Sometimes it used to extend, pain used to extend to low back or lower abdomen. Pain, aggravation, it increase movement, any aggravation from the movement and better by the rest. They brought this sonography report. It's a bilateral renal calculi with left hydronephrosis. Okay, what is the drug? Renal colic. Severe pain. And you all know Cantharis. Good. You all know the renal calculi pain, renal colic will be very severe. Severe pain will be there. Bryonia. Good. Bryonia on the modalities, aggravation and amelioration. Colosynth. Beautiful. Sarsaparilla. Very good. Macphas. Beautiful. Lycopodium, because it is right-sided. Okay, good. Bryonia and Macphas. Belladonna. Satya, why belladonna? Good. Suddenly. Why belladonna? What made you to think belladonna? You can unmute and tell. Shooting kind of pain. Acha, acha, acha. Nature of pain. Okay. I have not written here any shooting kind of pain, but okay. Shooting kind of pain. Berberis vulgaris. How can you forget berberis for the renal calculi? Berberis vulgaris. Beautiful. Good, good, good. All these medicines, solid or vira. That is also. Solid or vira is also beautiful remedy. All these medicines are wonderful remedies for the renal calculi. But here, the hematuria, which made me to determine our match good, I gave sarsaparilla for this lady. Sarsaparilla, which not only stopped the blood in the urine, reduced the pain, and it helped to bring out the stones. Acute phase, we give sarsaparilla. Over the period, once the acute phase is over, she received berberis also, berberis vulgaris. With sarsaparilla, her hematuria, pain, and the hydronephrosis, this thing is reduced. Here, the peculiarity is even though pain was more in the right side, but hydronephrosis was on left kidney. But pain was showing more in the right side. Okay. So right-sided, hematuria, this made me to think of the sarsaparilla. If this same lady, if she had too much of burning type of pain, definitely I would have thought of Cantharis. Cantharis, the pain, nature of pain, even though hematuria will be there, it is more of burning, especially at the end of the urination. Severe pain at the end of the urination, you have to take the Cantharis. Okay. And which is the drug when the pain from the kidney or the abdomen, lower abdomen, the pain extend to the pubic region, testis. I treated one case of the hydrocele with this symptom. Wow, good. Sepia, I think Jasmine, you are there when we gave that patient medicine?
Yes, sir. Yes, sir.
You are there. Correct. That's why, see, that is the remedy. When the pain extending from abdomen to the testis, pain extends to testis is the sepia. Beautiful. Good, good, good. Next. This is also a good case. So, he's an artist. He completed his degree from Shantiniketan, Rabindranath Tagore's place, Shantiniketan. Both husband and wife is an artist, painters. Sanjay Singh was aged about 44 at that time. Now he is 60 plus. So he came for the fever for last 5 days. Okay. That fever started as a burn in his left leg. So he has that bullet bike. That bike, when he was starting the bike, when he was kicking that, suddenly his leg touched to the silencer, which was already run and came. It was off. Again he started. And this thing, he touched the silencer. Complete heat, this one, no? So he got burned. He was telling, sir, this problem started after that, the fever. Because of that pain, burning, the burn pain, he started fever. Okay, that silencer touched that one. Part is red, mild swelling. Okay, severe pain. Pain was 3+. Burning pain, unable to sleep due to pain. Fever, which reduces with the antipyretic. He used to take some fever tablets. Okay. Whenever he takes fever tablet, fever is to reduce. Again, it is to start next day. Next day, after the 2 p.m. Every day, the fever is to come at 2 p.m. sharp. When you take the tablet, it reduces. Again, next day, next afternoon, 2 o'clock, again pain is to start. Then again, fever is to start. So when fever comes, he knows he need not to see the clock. He knows that it's 2 o'clock. Okay. Which is the remedy? Which is the remedy? Fever due to burn. Ah, good. Arnica. Very good. Very good. Very good. Okay. Next. Sidran. Array. Nishi. So beautiful. Sidran. Why?
Sir, the
Why Sidran?
peculiar, sir, the same time the fever starts.
Correct. Correct. It is a clock-like precision. It comes exactly same time. Clock-like precision. So he received the Sidran. Sidran not only helped him to reduce the fever, it also helped him to heal that wound. Okay? Good, 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 good. Next case. If you are thinking our medicines only for the fever, cough, cold, just see this case. This is acute emergency. Acute emergency. This patient was my student in the college. She had sudden severe abdominal pain with vomiting. So unable to even to take the water, forget about the food. She was admitted to hospital. There, when they done the scan, they come to know that you have the report. Come to know that this was a feature of acute pancreatitis, and there was a free fluid in peripancreatic region. They had calculi in the gallbladder. Sludge was there, and in CBD, common bile duct, small calculi at the common bile duct measuring 2 to 3 mm. So due to this severe pain and calculi in the common bile duct, they advised for the surgery. They posted for the surgery. As you can, I don't know, you can see the date. 4/12/2013. As the surgeon was out of station, so it was posted, surgery was posted on 7th. So she called me, sir, can we help? She having this poliolithosis for quite some time. She used to take some homeopathic medicines from the other senior homeopath. So, but she was sudden this thing, she could not, did not help her other routine medicines. So they admitted, she called me. I told to send somebody to collect the medicines. I sent on 3 packets. I told them on 7th, before going to surgery, take one more scan and decide. She came on husband came on 4th night. We sent medicine. He gave medicine. Next day, pain reduced. She started taking water orally. 5th, sorry, not a 4th. 5th they came. 5th they came. 4th they admitted, scanning. 5th they came. On 6th, she was symptomatically feeling better. So I told to take scan, one more scan before going for surgery, and next day, 7th. But radiologist was not supposed to be there. So they told, you cannot have this scanning on 7th. So she told, can I go for on 6th itself? I told, okay, there is no other go. Next slide. Next slide. See, you see the date on 6th. see the report. No calculi in CBD. No calculi in the CBD. Cholelithiasis with a normal wall thickness. Mild ascites. Normal size of the pancreas. You got it? Pancreatitis reduced. The history of acute pancreatitis. Present scan shows normal size of the pancreas with a mild altered texture. No necrosis. No peripancreatic fluid. Cholelithiasis, normal wall thickness. Prominent CBD, but no calculus. Mild ascites. The surgery was cancelled. What do you say? Huh? You got it? This is what the homeopathy can do. Even in acute emergencies with the proper right medicine in a right potency, if you give, then you can get the results like this. This is not what I'm talking. I'm showing it. I'm showing on the, this is the evidence based. I'm not talking just on this one. Okay. Good. If you think our medicines act for the acute medicine, acute prescription, next day or next to next, phosphorus, huh? Oh, good. Jayalakshmi, phosphorus. Good, good. What is the indication, Jayalakshmi? MacFast. MacFast. Good. MacFast for the pain. Huh?
Throws up water as soon as it gets warm inside the stomach and throws up ingesta.
Not warm.
That is,
She was unable
I
to
mean,
retain even the sip of water in the mouth itself.
yes,
The moment
yes,
it
yes.
goes.
Yes, yes, yes.
But what you thought, that is the right one, right? This thing.
And it's also indicated for pancreatic disease and also.
Pancreatitis, one of the beautiful medicine. Pancreatitis, phosphorus, pulsatilla. Pulsatilla is also one of the beautiful medicine for pancreatitis. I cured so many pancreatitis cases, both acute and chronic, with the help of pulsatilla. Okay, good, good. But here I gave sulfur CM. CM. You have this one, no? So homeopathic medicine, anything used above 1 name and all, you are afraid. When there is a right indication, right to this thing, you give right the potency. See, this was emergency. I wanted to, we did not have time. Okay? Okay, good. So with this, we can take one more case. Sir? Venkatraman sir?
Sure, sir. Yeah, sure, sir.
Okay. So I will show next case. Quite interesting one. Okay. Next. Case number 9, Trupti.
Yes, sir. It's there.
Okay. Elderly male, one Mr. NR. He was retired general manager from HMT. At that time, HMT was a very popular, HMT watch was very popular brand. So he was working for that company. A fair, well-built elderly male, aged about 60 plus years, brought to me to my chamber with the help of his son and wife. At that time, my clinic was in first floor. Okay. So actually, one side his son, other side his wife. On he put both this thing, and those people brought to me in the evening around 6:30, 7 o'clock for a severe pain in the low back. lower back. Okay, since morning he had the pain. Moment when he started waking up with that only, with sweat and excessive weakness. Attendance taken to nearby nursing home. They took X-ray, which was suggestive of herniation, bulging in L4, L5 and L5, S1. Okay, so next. Location, it's the lumbar region. Sensation, sharp stitching pain. Modalities, which used to increase in the beginning of the motion, extending to down up to the buttocks, thigh. Nothing makes patient better, neither walking nor rest, any particular posture, cold or hot application, nothing. No changes with any either posture or with the thermal. Okay. Concomitant, it was sweat and excessive weakness, sudden weakness due to that pain. I put 1 dose of medicine dry on the tongue and packed another 2 packets of the same. Told them to repeat after 4 hours if as the pain persists. Okay. So if pain increase, he can make it water dose. If pain reduces, stop the medicines. Okay. So I told and sent him back. He came back after 15-20 minutes to my chamber and started looking at me. Well, just he came back after I saw another one or 2 patients. He came and just started standing there and smiling. I thought he had any doubt. I thought any doubt. Again, he looked at me and smiled. And then after a while, then he just smiled and told, I think you did not notice I walked alone to your chamber. He went down. Just before boarding the car, he got one sound, cracking sound. Suddenly, he started feeling better. He climbed up to first floor and came to me to show is this thing. His pain relieved immediately. This is the magic. This is the miracle of homeopathic medicines. Not the days, weeks, hours, minutes. This case I showed only to show that how fast our medicines, right indicated medicines works. Moment you put it on the tongue, it start working from that time. Within few minutes, patient came back, walking, climbing the stairs. So the right remedy in right potency, it can make, it can change. Got it? Now tell me what is the medicine? Jayalakshmi Ganeshan, Kale Kar. Good. Next, any other medicines? Why Kalikar? Balchandar ji. Sepia. Sir, why Sepia? Why, sir? Colocint. Good. Colocint for pain. Colocint acts much better on the muscles than the bone or this thing. Okay. It is more of an abdominal pain than the back pain. Next. I was thinking why this drug did not come. Rastrax. How come you forget Rastrax? Hypericum, beautiful medicine for the pain and back. Good. Hypericum, Rastrax. Somebody, one more drug they put. Which one? Sir? Rastrax, Kalicarb only. Okay, Kalicarb. Good. It was Kalicarb 10M. Zincamet also beautiful remedy. Okay, good. It was Kalicarb 10M. Kalicarb has the concomitant of sweat. Otherwise, the Rastrax, Bryonia, Brainia and Kolikar pains are almost same. Brainia and Kolikar pains are almost same. Okay. In Brainia, it will be thirst. Thirst, if it is a thirst, then that will make indicative. In Kolikar, the weakness or the sweat. Ruta is also beautiful remedicine, but Ruta is more for the muscular and injury. You can think of Ruta. Ruta or Astrax. Good. Okay. So with this, till 5 minutes are there. Ashita, I finished my lecture within that time. She told me, sir, by 12 o'clock you have to finish. Okay. So another 5 minutes. Okay. So any questions are there? You can fire me, shoot me. Or anything else you want to know about acute diseases, acute prescription?
Sir, in what type of cases do you go for high potency, sir? NM, PM and all.
What type of cases?
What kind of cases you go for high potency?
High potency.
Yeah.
Sir, the potency will be decided generally with the in acute cases with the intensity and the reactive power of the patient. Reactive power of the patient. Usually in acute conditions, I prefer on the little higher potencies. If they are from the vegetable kingdom, definitely yes. Okay, higher potency. Acute condition itself, because it's sudden in onset, intensity will be high. Usually it will be called for the high potencies. Unless otherwise there is a structural changes or acute exacerbation of the chronic disease. For example, I will tell you, not only for this pain patient, even for the fever and wheezing cases, sometimes in my clinic I give medicine, ask them to sit, wait, reduce the fever or reduce the wheeze, and I'll send it. I'll remember one case now. I'll just, for your this thing I wanted to tell you. A lady around 30 plus lady, well built, this thing, like a calcarea type of lady. She came with a sudden onset of the wheezing sound, where when she's sitting in the waiting room, I could hear it even in my chamber. That much of wheezing sound was there. Wheezing was there, but she was a known case of asthma. Okay. So I gave water dose of the medicine. I mixed the medicine in 100 ml of water, and I told them, take this water every 5 minutes, 10 minutes once, and sit or lie down in my waiting room. She started sipping. After 2-3 doses, her wheezing came down drastically. She could start breathing better. And she came and told, sir, now I go. I mean, I'm feeling comfortable. I auscultated. She was better. She could breathe. I sent few more packets and asked if necessary night, if it again comes, you do it. Okay. What may be the medicine and potency? Medicine, Blata orientalis. Blata orientalis, and I gave it in 30 potency. Acute one, but 30 potency, because it is acute exacerbation of the chronic disease. And she used to, previously I gave for her for arsenic calm. Arsenic and Blata symptoms are almost similar. If you read this thing in Metramedica, it's given, when arsenic fails, think of Blata. And Blata works for better for the plethoric patient, little well-built patients. That's what. Right remedy and in right indication with right potency. Our medicines give the results in minutes. Okay? Okay. Any other question?
Thank you.
Yes, sir. Balamurugan, sir. Tell me, sir.
Thank you so much, sir.
Thank you, sir. So there is one more question in chat box. Somebody can read. Kamala Aji. Kamala, sir, I am finding it difficult to treat cough after fever. Can you please suggest? Yes, ma. This especially this viral cough, viral fever and cough is little difficult to treat. Problem is because they give antipyretics, they take some fever medicines, reduce the fever will go and cough will not. Especially when this thing, any viral disease, when you give only for the fever, problem is the disease will not go. This similar type of cases I used to see in chikungunya case, where patient used to suffer with they used to have the high fever, body pain and all. They used to take paracetamol or painkiller. That's what they used to give. After that, fever is to go, pain never is to go. Pain in the joints remains. Sometimes I've seen the cases suffered for the months and years after chikungunya. Because when virus is there, this thing, when fever is there, virus will be killed. If you suddenly stop the fever, virus will not die. It will go and accumulate and start in the joints or in this thing. That's why when the cough will not reduce or the pain will not reduce after if you treat only fever. So while treating, always give the medicine which covers both fever and cough. Then you will have a better results. Okay. Generally, there are few medicines you can think after the fever, cough remains. See, one of the beautiful drugs is antimonium tart if there is an indication. For all our prescription, indication is a must. Okay. Antimonium tart, even the natramure is beautiful medicine. Pulsatilla is a medicine. If at all, if the fever is like intermittent fever type, cough after intermittent fever, the only remedy in Kent is natramure. Okay. Any indicated medicine, it will work. Okay. These drugs I tell is when there is no other indication. You can think. This and weakness, excessive weakness after fever. These are the commonly we come across. Which is the remedy? Excessive weakness after fever. Cinchona, acid fast. Acid fast, yes, okay. Cinchona is a beautiful medicine. Califas, China cinchona. Okay, both. Califas is also beautiful medicine. Arsenic, yes, arsenic also you can think, but better than arsenic will be the cinchona. If any indication is there, then you can give. Sir, can you please share the diagnosis of the first case, the 6 months baby? Okay. See, they came with this thing. Even today, I don't know what was the reason for this swelling. But the swelling started reducing after the child passed 4-5 loose stools and flutters. We thought it may be a gastric one. Okay. Next, any other one? Good afternoon, sir. Why you choose high potency pancreatic case instead of low potency? Here, Madam, it is pancreatitis, even one is inflammation, sudden inflammation. Okay. Low potency, being that lady was young, high energetic. Okay. If the same case, if it is where the organs pathology is involved, here, even though it is a disease is there, it is itis. Inflammations are acute. If it is necrosis, calculus, pancreas, even in pancreas there will be stones, you know it. Then you would have thought of low potency. And here, one of the main reasons why I selected the high potency is the time. Either do or die. We had only very few days left for the surgery. Not few, just only 2 days left. They came on 5th evening. Only the 6th, the 7th morning was surgery is posted. I had hardly 1.5 days. Okay. So that's why my selection of the potency, I thought of giving high, so that the strong SORA has to, you have to activate the SORA. You got it? See, selection of potency is always based on the miasm mapping and sensitive index. Okay. You have to know the miasm and sensitivity or susceptibility of the patient. That gives for the selection of potency. Other things are there, you know, the chapter nosology in Stuart Close you read. He gives when to select which potency based on the source of the medicines. So if it is a plant-based, high one, no source, high potency, animal-based, medium potency, minerals, low potency. These are all the general guidelines. Your experience makes you to break the rule. One is rule, if you should know the rule very well with the experience, so that you know when to break the which rule. That is called as improvisation. Okay.
Thank you, sir. Thank you so much, sir.
Thank you, sir.
Thank you so much, sir. Now I invite our governing body member, Dr. Venkatraman, sir, to say a few words regarding this meet and Swami sir's presentation.
Thank you, Bala. Thank you, Dr. Swami sir. It's a wonderful session. It's really an eye-opener, I will put it that way, because in the beginning you said a lot of people, public think that homeopathy is only for chronic disease, not for acute. But Dr. Koppikar used to say, this concept is created by the homeopaths because they don't know how to treat acute conditions. So it's not the public, it is only the homeopaths have created it. So treating an acute, so it's a common thing. When you can't treat an ordinary fever and cold, you cannot claim that you can treat cancer and other conditions. So nobody will believe if you can't treat an ordinary simple conditions. So that way, learning to treat an acute condition actually improves, creates a respect, not only with the patient. First, it creates an impression that as you are a doctor from the family, your own family members start believing you that you are a doctor first. Then comes the patient and public. So always learn how to treat acute conditions. Everything will be very tricky. See, for example, this podophyllum case, what Sarah's prescribed, it's a rubbing abdomen. Okay. But what happened, the patient is drowsy during sleep. But we know podophyllum is loquacious during sleep. He talks much. So some of us will think, oh, there is no loquacious. Why should I give podophyllum? Not like that. So whatever the symptoms are not there, you ignore it. Whatever the symptoms are available, you catch hold of. So one of the important things is rubbing. That is there in podophyllum. So podophyllum works beautifully. If rubbing is not there and the patient is talking, then also podophyllum will work. So in that way, whatever that is the symptoms available, we should learn to take it. And he has given another wonderful case of back pain, the Calicap tenon. I don't know how we both get related to that. My favorite potency is also tenon, particularly in case of Calicap. Though I use all other low potencies, Calicap, particularly for the back pain, I used to give Calicap tenon. And I have seen a similar beautiful results. I really feel that I have seen his clinic, then I copied from him, or he has seen me and copied it. So such a beautiful thing. That is the beauty of homeopathy. Even without knowing each other, even living apart, without entering their clinics, we think similar, we work similar, and we act similar. So that way, it's not only homeopathy is similar, even the doctors have become similar like that. And definitely a wonderful case of Calicap. That patient, that beauty never comes. But I had to add you one more warning. Luckily, sir has treated that pancreatic case, keeping the patient in the hospital. So always remember, in acute condition, remember that sometimes the emergency, if the things are not in our favor, patients can have a lot of problems. Sometimes the medical legal problems are also. So always learn to diagnose the case properly, refer them to the proper physicians properly, and then also interfere in that way. And never ever bother who gets the credit. If the patient becomes all right, that is the greatest thing. So this this pancreatitis case, they would have received the drips, some other medicine in the hospital also possible. So that allopathic doctor will claim that he has cured the case. Dr. Swamy says he has given it. Patient will come to us and say, sir, because of your homeo medicine, I have become all right. Same patient will go to the allopathic hospital and say, sir, because of your medicine only, I have become all right. We are not bothered about which medicine has made them all right. But what is more important, the patient is happy, patient is all right. So that is the most important thing. Sometimes in acute conditions, even if we are not able to treat, if we refer the patient in a proper time, in a proper condition, then that patient is lifelong loyal to us. So it is not only treating, it is the diagnosis and it is proper reference that makes much more important in acute conditions. And once again, I thank Dr. Swamy. And there's a wonderful session. And you all should learn how to diagnose acute cases, how to treat acute cases, and record all your failure cases and then analyze where you have failed. Success cases, sometimes we are not able to analyze, but failure cases, we can analyze a lot. So I request all of you, see like cough, somebody asks fever, I'm not able to treat the cough. So this is the beautiful condition. So we must have a next session, how to treat a cough. Even I am one of the cough patients who suffered a lot. So there's a lot to be learned from how we are going to treat that cough after fever and this viral cough. If we can give that relief, you are giving life to the patient. So thanks for giving an extra topic also that we can discuss about how to treat cough, simple cough, where we can do a lot, we can do wonders in that conditions also. Thank you so much.
Thank you, Swami sir, and thank you, Venkatraman sir. Now, I call upon IHML Kancheepuram Chapter President, Dr. Satya ma'am, to deliver the vote of thanks. Please, ma'am.
Hello. Good morning, all. On behalf of, can you hear me? Can you hear me?
Yes, yes.
Yeah. Yeah. On behalf of IHML Kancheepuram Chapter, I hope this is the first webinar, and I'm very glad and heartfelt thanks to Dr. Swamy sir and Dr. Venkatraman sir. Time is the most precious thing, and that he has shared his knowledge to us with his documentation, especially in acute cases. It's really a challenge in treating acute cases rather than a chronic cases with our medicines, because people mostly have confidence over chronic cases being treated with homeopathic medicine, but not with the acute cases. But after seeing this pancreatitis case, it really boosted more of confidence. So I'm really thankful to Dr. Swamy sir. And thank you again for all the one who are present over here and the technical team. who have conducted this webinar. Thank you so much.
Thank you, ma'am. On behalf of everyone present here, I extend my wholehearted thanks to our chief guest, Dr. H.L.Swamy, sir, who spared his time from his busiest schedule to grace our occasion. Today, we had an opportunity to hear your valuable thoughts, sir. Once again, thank you, sir. And a special thanks to our Venkatraman, sir. Thank you, sir.
And most important, thanks to all the participants. That is most important thing. Okay. A nice gathering. Thank you. And
Swami sir, you have to unmute yourself.
Swami sir, you have to unmute yourself.
So I thank Venkatraman sir and the whole team, IHML team. We are doing wonderful work. God bless you all. I'm seeing a lot of youngsters doing wonderful job here. Good team. Keep it up. I personally thank Dr. Trupti to helping me in these slides. For the slides, I thank all the participants for nice interactive session. Your questions, it made me my day. I thank you. Thank you very much, sir. Vikram sir. Thank you.
Thank you, sir. Thank you, sir.
And thank you.
Thank you so much, sir.
And thank you, Nitya, all the team, HML Kancheepuram team. Good. So once again, Happy New Year. Thank you.
Happy New Year, sir. Thank you so much, sir.
Yeah, can leave the sessions. Thank you, everybody.
Okay, Bala.